Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about social anxiety disorder. In this video, we'll first look at what social anxiety disorder is, the different types of social anxiety, and the differences between social anxiety and shyness. We'll then look at some statistics, risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Social anxiety disorder is a mental health condition involving excessive fear of being humiliated, scrutinized, or rejected in social situations. The fear can be related with social interactions, being observed by other people, and/or performing. This fear can affect everyday functioning for at least 6 months. Types of social anxiety. People with social anxiety can experience mild, moderate, or extreme forms. Mild social anxiety. People with this type can have the symptoms of social anxiety, but they still take part in social situations, or they may only experience social anxiety symptoms in certain situations. Moderate social anxiety. People with this type may have symptoms in some social situations, but they also avoid other kinds of social situations. Extreme social anxiety. People with this type can have extreme symptoms in social situations, such as a panic attack. Thus, they completely avoid social situations at all cost. Differences between social anxiety disorder and shyness. Social anxiety can hinder or prevent people from completing daily activities, including going grocery shopping or speaking to others. As a result, social anxiety disorder can impede one's career, education, and relationships. Experiencing shyness occasionally does not affect these things, or at least not on the same level. The 3 primary factors that differentiate social anxiety disorder from shyness include how much it affects one's daily life, the intensity of one's anxiety and fear, and how often one avoids certain situations. Statistics. Social anxiety is one of the most common anxiety disorders, as well as one of the most common psychiatric illnesses. In Canada, 8% of people will experience social anxiety disorder in their life. The 1-year prevalence rate in Canada is 6.7%, while it is around 7% in the United States. Social anxiety is typically chronic. Some indicate that the average length is around 20 years. Risk factors and causes. Social anxiety disorder is believed to be caused by a combination of psychological, biological, and environmental factors, such as a family history of anxiety disorder, stressful or traumatic experiences such as bullying, other mental health conditions, or substance use disorders. The symptoms of social anxiety disorder typically appear before the age of 18. Social anxiety disorder affects more women than men. Symptoms. People with social anxiety disorder can experience symptoms when they are around other people or when they have to perform in front of others. The symptoms can be present in social situations, a variety of situations, or all social situations. The cognitive symptoms of social anxiety disorder can include self-consciousness, fear of negative judgment, fear of rejection, fear of embarrassment, awkwardness, and feeling of one's mind going blank. The physical symptoms can include blushing, sweating, rapid heart rate, dry mouth, trembling, nausea, stiff body posture, muscle tension, and headaches. Behavioral symptoms can include avoiding social gatherings and parties, avoiding eye contact with other people, avoiding public speaking, and being passive in social interactions. Effects. The symptoms of social anxiety disorder can be extreme and disrupt one's routines, work, school performance, and social life. It can hinder a person's chance in completing their education, obtaining a job position, developing friendships, and finding a partner. People suffering from social anxiety disorder have a higher risk of developing major depressive disorder and alcohol use disorder. Treatment. Social anxiety disorder can be treated with psychotherapy, medication, or a combination of both. A common type of psychotherapy is cognitive behavioral therapy, which educates people about different methods to perceive, behave, and act in certain situations to lessen their anxiety and fears. Cognitive behavioral therapy can help people improve their social skills. It can be delivered in group settings as well. A method of cognitive behavioral therapy is exposure therapy, which can help people gradually confront their fears to participate in social activities that they have been avoiding. Another type of psychotherapy is acceptance and commitment therapy, which utilizes mindfulness and goal setting to decrease anxiety and fears. A healthcare provider may also prescribe medication for social anxiety disorder. These include antidepressants and anti-anxiety medication to reduce one's anxiety symptoms. Coping strategies. There are several different ways to cope with social anxiety disorder, including trying to understand one's anxiety by writing in a journal about one's thoughts and behaviors in social situations, managing stress such as using breathing techniques, exercising regularly, eating healthy, avoiding alcohol and drug use to prevent from worsening the anxiety, trying to focus on people's words instead of making negative assumptions, joining a support group, and spending time with family and friends. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.